Hi and welcome. That's Gerard, and what we're doing today is our first podcast, so if we screw things up, please bear with us. With me today I've got Dr. Dustin Halse. Dustin is heading up our research component. With Dustin is Dr. Laura O'Connor, who's also a key member of our research team, and we've got National Secretary with us, Lloyd Williams. Don't hold Lloyd back too far, and you've got to forgive him, he's a Collingwood supporter. So thanks for being involved and thanks for looking at what we're doing. Such an important day today is all about the Special Commission of Inquiry. The Commission of Inquiry, which everybody said could not happen, was too expensive and won't deliver anything. So we firmly believe to change the way health works in New South Wales, we had to have a foundation piece, and credit to the New South Wales government for taking this step. So I guess the first thing to talk about really is how do we get here? So what's your view in terms of how did this all start?
Yeah, really good question, Gerard, and it goes back to the union's advocacy back at the end of 2022 and into 2023 when HSU commissioned Dr. Angela Jackson from Impact Economics to produce a seminal report, Reform Critical, a fragmented health system at breaking point. And this report highlighted some of the cracks in the current health system. And we need to increasingly have a health system that's smarter, that is more efficient, that understands the role of the health workforce within it. At the moment, we've got a system that, if it continues in its current form, will become unsustainable within a generation. We've got this system of healthcare in Australia which increasingly is heading towards that Americanised style of healthcare. It's a system of have and have nots. Yeah. And so HSU, its responsibility is to address some of those shortcomings and to make sure that we have a system that's sustainable, that looks after patients and consumers, built upon a properly planned and equipped and resourced workforce.
And you're in part of the workforce. So being a RT, radiotherapist, what's your take on I guess, the Special Commission Inquiry number one, but where do you think that is going to land, particularly allied health professionals, into the future?
From my perspective of working in public health, as Dustin said, the cracks were forming, but I felt like COVID was really where they started widening. That's where, we're all pushed to our limits, and budgets were pushed to their limits because of the extra resources needed. By the time COVID was over, it kind of didn't revert back to normal. Those cracks were still there and they just kept widening. So at the moment, we're kind of stuck in a pattern of putting band-aids on our problems, and that's how I see the Special Commission of Inquiry into healthcare funding can actually get back to the root cause of the problem rather than putting the band-aid solutions. And I think the really big thing for allied health that came out of COVID, they were a very reactive workforce, so they were able to plug holes in the system at the time. They showed how valuable they were, and we can actually build on that now that, hospitals aren't just doctors and nurses, but we've actually got a really well-prepared workforce, really educated workforce.
From a national perspective, what's happening and what's been identified in the Commission of Inquiry in New South Wales, it's not germane to New South Wales, is it?
It's right across the country, but I think every single state should have one of these commissions of inquiries, and we really need one federally as well.
Yeah, it goes to the point, doesn't it, that virtually in New South Wales, and I expect every other state, there's going to be 10% of hospital beds are taken up with aged care patients or NDIS patients, and clearly it's a federal issue. One of the recommendations which I thought was really interesting, going back to what you were talking about, COVID and what came out of COVID, there's a wellbeing position that's been identified. What's your views there, Dustin?
Yeah, we feel that it's time in New South Wales for them to take the wellbeing of the workforce more seriously, but through a different approach. We're aware that there are wellbeing programs right throughout New South Wales Health, but we think an independent office that can oversee wellbeing right across the workforce to give workers greater tools to understand how they can best protect their wellbeing, but also better avenues for them to raise issues in the workplace. Workers should want to be engaged in their workplace. They should feel fulfilled. They should feel respected, and we should, instead of just running a People Matter survey, we should be more engaged in the workforce, listening to them, making sure that they're often very tangible, but simple concerns can be met through an independent mechanism.
And that's from my perspective as well, that it's all well and good to have People Matter surveys, it's all well and good to sort of say, oh, here's an IMS program, make your reports through there. People aren't reporting, and we know why, because they see there's no back end to it, there's no outcome to it. And if you want to maintain a workforce, isn't the build up, the training and all that you do to establish someone, to let them go? It just doesn't make sense.
Speaking again from my own perspective, I felt like management kind of got further and further away from realising that their responsibility was also the workers' psychological safety. I think it's really good to actually have an avenue that's actually bringing that management focus back to the workers and to their well-being. You mentioned the People Matter survey, and there's a really good question in it that I always go scroll to every year, and it asks, do you think anything will come out of this? And it's always a very strong no, isn't it? So I think like that in itself is a really strong signal from the workers that we need to do something, that they don't even believe that these surveys or what's being done at the moment is enough to change the workplace culture.
And I think, Lloyd, you'd agree in every other state as the National Secretary that attraction and retention is the key issue of a health workforce.
Yeah, the other problem that we've got right across the country is the attraction space. So the federal government's done great things with, nursing, teaching and social work, but they need to expand their placement poverty subsidy to all allied health. So we're going to deal with the attraction, but when we get people into our health services, we've got to care for them, support them, value them so that we keep them.
Because that's something I just don't get, to be honest with you, that we know there's an attraction retention issue. We know it's a global issue post-pandemic, and yet we're still trying to, just run on the same treadmill and get a different outcome.
Yeah, keep band-aiding the system. That seems to be the policy approach from governments, and they just need to have a holistic strategy to expand and allow allied health professionals to work to their full scope of practice, integrate them better into our health services, and it means we're going to get better discharge, better throughput and better outcomes for Australians' health.
It is, and I think if we don't get this right now, it becomes really problematic for not only the younger generation coming forward, it will become even more problematic for the older generation, you and me, Lloyd. It's really sad. It's something that we need to be able to get on top of, and I think broadening the theme of the Commission of Inquiry into universal healthcare, and we've been meeting with Dr. Margaret Foe, and she's got a book coming out in the next week or so in relation to Medicare and universal healthcare and the pressure that that's under. As we all know, the Medicare system came out virtually of the trade union movement in the Accord back in the 80s, and bit by bit it seems to be contracting into who can afford it and who can't. My real concern is, particularly in regional New South Wales, regional Australia for that matter, how many people would be wanting to go and see a GP but can't get in because the books are closed. There's not enough GPs there. Then you may have symptoms of bowel cancer, let's say, but you put it off because you can't afford to see the GP, or you can't get in, and then symptoms get worse, and next thing you know, you're going through the ED and being diagnosed with stage 2 or stage 3 bowel cancer. That could have been prevented earlier. Now, I keep talking about the back end savings to these things. Paramedics who intervene early, give antithrombolytic drugs. A patient, costs a bit of money there, costs a lot of money in training, but that patient doesn't sit in an ICU for a week and a half at $10,000, $15,000 a day, but we don't measure that. And this is, unless we're going to follow through and measure the back end savings and the back end efficiencies and productivity, we're just going to keep looking at the same system.
And it's interesting you bring up the cost of healthcare. So we in the research team surveyed our members at one point, and we found that 44% of our members surveyed say that they can't afford healthcare, that they specifically don't go to a specialist or to a doctor because they can't afford it. And as you say, there's the flow-on effects, and the Australian Institute of Health and Welfare just came out with some really interesting data, and they showed that in New South Wales, as you're saying, the preventable hospitalisations costing us, like our state, $2.1 billion every year.
And how many times we talk about like juvenile diabetes, but we don't talk about the promotions units that bit by bit are being contracted. So child obesity gets bigger, and forgive the pun on that. But the reality is, kids get sicker.
Yeah.
But we're not preventing it because we're not going to invest that money up front. Yeah. And I think that then goes to the point of the federal government having a buy-in, don't you?
Yeah, and look, universal healthcare in this country is an interesting topic to discuss because we have a universal public health insurance scheme, but we don't have universal healthcare. No. Let's be perfectly frank. We have a system in which if you can access a GP, that GP may choose to bulk bill you. We've got a tremendous hospital system, but the wait lists for people to see specialists in this country are huge, particularly in regional and rural locations. And we know that it's a system, again, of have and have nots, in which if you've got access to private health insurance and you've got the financial capacity, you can see or engage with the health system in a way that many people can't. And that's really problematic because health services and health inflation is growing at a rate far greater than inflation throughout the entire economy. State governments are dealing with huge budget issues with respect to their health budgets. And we prioritise fantastic acute level care, but as you said, we aren't engaging in that preventative community, multi-integrated care that keeps people out of acute settings and actually keeps people healthier, so that healthy populations approach to healthcare that takes pressure off the hospital system, that takes pressure off our ambulance services. We haven't got that right yet. And that's in part because, as Lloyd was saying, we don't have people working at their top and full scopes of practice. We don't have truly integrated health services. We in Australia are almost at the bottom of the OECD rankings with respect to our spend on preventative healthcare. And the state and federal governments keep pushing it between each other. Who's responsible for what? Well, someone needs to take the reins and say, well, we need to get better healthcare in the community that engages with allied health professionals, that engages with the full health system so that we can keep people out of hospitals.
So do you guys think that there's a natural bias to business as usual? And is there a vested interest to have business as usual as opposed to, here, let's be innovative and deal with 2025 and beyond, as opposed to, feudalism and up to 2025?
Well, I think that's the easiest way to go about it. But I think, like I said, we've got constrained budgets. We're putting band-aids on, the holes in the bucket at the moment. To spend that money, like I said, they spent that money for the extra staff, but it takes a year or two to see those savings. So I guess that's where the reluctance is to spend the money that you haven't got the savings for yet.
And you've got professional D-marks, haven't you?
Absolutely right.
Our health services is everybody making a difference. It's not just doctors and nurses saying that they are the clinicians who deliver health, allied health people, you can't get diagnostics without our allied health. You can't do restorative care without allied health. You can't do preventative care without allied health. So we need to break down, those barriers. And it's great that you've still got state awards because you can do so much with your state award.
Well, look, it's just got to happen. Otherwise, as I said, I think the next generation will have serious problems.
Yeah.
But the older generation, there is a tsunami on the coast coming in, and we've probably got about 5 to 10 years, and we will see older Australians, having really difficult end-of-life positions, which we shouldn't, after someone's contributed to the community for so long that, am I going to be a burden because, I'm coming to the end of my life? And I find that to be really unacceptable. The other thing, I'll just touch back on the SCOE again, is that I'm really impressed that the government's gone down the path of dealing with locums internally. That has, I've seen figures of locums $7,000 a day, $35,000 a week, times whatever number. And then you've got the agency who, basically takes their cut off the top of that. This has got to be something that can really save money, be more efficient, then generate outcomes. Well, thanks very much for being here today. This is, as I said, the first time we've tried this, and it's all about being informative. If we can do things that not only from an industrial perspective, but also a social perspective, because the union here works on three pillars. One is certainly our industrial pillar, our political pillar, and our social pillar. And so if we can deal with the social issues as well as our industrial interests, I think we better get a better, or contribute to a better community. So thanks very much for your time today.